Thank you very much. I've been asked to talk about gastroesophageal reflux disease, or as a lot of people call it, GERD, okay? And this is a very common problem. It strikes 1 out of every 3 people in the world, okay? There are 70 million people known right now that are on some sort of acid medication, and there are probably millions more that we don't know statistically, but the most accurate estimate is 1 out of 3, okay? So let's talk about, to understand what gastroesophageal reflux is, we have to understand a little bit about how the stomach works, okay? So everybody has an esophagus, which is the tube that joins your mouth and your stomach. So your mouth's up here and you have this tube, okay? And I'll explain to you what this is later, but this opens up into your stomach like this, and then the stomach kind of goes down and it turns into your small intestine as it goes down through your body, okay? Well, your stomach and your lungs are here, okay? And then you have a diaphragm, which is kind of a muscle that separates, and that's what helps you breathe, like this, okay? So the stomach produces acid every day to help you digest food and to break down food at first, okay? And it's protected from its own acid, okay? It has chemicals in there that keep it from hopefully digesting itself, and so it's pretty safe for the most part. But your esophagus that connects your mouth to your stomach doesn't have this protective lining, okay, or protective chemical. So anytime acid can hit this, it can definitely irritate it. So your body has this kind of muscle fold. It's really a folded tissue, and this is called, this right here is called the lower, meaning the lower section, esophageal, which is this tube, sphincter, okay? So it's a little muscle fold that is now here, and it's supposed to be shut 99% of the time, and it's there so the acid hopefully will not shoot back or reflux into your esophagus. So this thing stays shut, and then when you actually swallow, this thing opens up to let the food into the stomach, and then as soon as you get done swallowing, it's supposed to shut back, okay? So, but unfortunately, as we get older, this muscle starts to loosen a little bit, so the acid can reflux or shoot back into the esophagus and irritate this tube, okay? So age is a big factor. Weight is also a big factor. There are other factors, mainly with diet, and the foods that seem to bother this and make this muscle relax are chocolate, caffeine, mint, spicy foods, and any kind of acidic type of food, okay? And so all these things can cause this muscle to relax. And the reason you, especially with mint, and mint is the single worst offender, okay? Any kind of mint. And the reason that is because it really relaxes this muscle and allows that acid to go up here. And the reason they give you mint, this is why we always take mints after dinner, is because, not because of breath, is because it makes you burp, okay? So everyone burps after they take a mint because this makes you feel better, and so for centuries we've taken that just to make ourselves feel better after we eat. Well, in reality that really hurts you because it opens up and the acid can shoot up into your throat, okay? So when people have this irritation, people have a lot of complaints of heartburn, and you feel like my stomach's a little sour, I have a little more gas, and all those things are related to this relaxing here and a little bit sometimes more increased acid production from what you eat, okay? But even though you have these classic symptoms, a large majority of people don't really have the classic symptoms of reflux, okay? The lesser known side effect, and this is where a lot of people come in, they don't understand, if you can have chest pain, and reflux disease and heartburn is one of the leading causes of emergency room visits because people don't know if it's their heart or not, and so they come in, okay? So this can cause chest pain, and that chest pain can feel exactly like angina or heart pain. And the reason that can happen is because the esophagus and your heart, okay, which the heart sits in front of here, and the esophagus and the heart, they share 1/3 of the same pain fibers. I mean, they're branches of the same tree. So sometimes if you have heartburn, it can feel just like your heart. And so that prompts you obviously to go to the emergency room, and I would encourage you to do so if you have chest pain for any reason and you're not sure what it is, okay? So that can feel just like a heart attack, and it can still be reflux. But the more scary thing is a heart attack can feel like heartburn, Okay, so that's the danger. That's an entirely different talk. But the heart pain can feel like reflux too, so you need to be careful in that regard. But yes, chest pain is one of the things that are not necessarily what you would think of when you think of heartburn or reflux. Okay, but also a very common problem with reflux is a chronic cough. Okay, you don't have to have the classic burning kind of sensation or gas. You can just have this cough that just doesn't go away. It's usually dry. Sometimes you can form a little bit of mucus, but really it's mainly dry. And you'll notice this cough really at night or in the early mornings, and then the cough will get a little better, and then it may get worse right before you eat. And then, but mainly it's late evenings and mornings. And the reason that is because, well, when you're sitting up like this, you know, gravity likes to keep the acid down, right? Because gravity pulls everything down. But if this thing is open when it's not supposed to be, and you go lie down, it's like pouring a glass of water, right? The acid, if you turn this whole thing sideways, all that acid is just going to flow right up into your throat, okay? And what it does is it splashes up against your vocal cords, okay? And that causes it to become irritated and inflamed, and it makes you cough. Okay, so cough is also a very common side effect of reflux that you may or may not know, even though you don't have classic burning. Okay, so you need to be evaluated with that. And also, hoarseness is also a leading symptom of heartburn that's not thought about by a lot of people for the same reason. The acid it bathes your vocal cords when you're sleeping at night, and it causes it to be swollen. And you can have hoarseness with that. So if you have hoarseness, that's also unexplained. It's not necessarily allergies. It very well can be heartburn, and more commonly it is. The way you diagnose those kind of things, if you have hoarseness or this frequent cough, would be to go to an ENT if you have these atypical symptoms. To have them look, they can look in your throat and see if there's any kind of acid damage even up in your vocal cords. So pay attention to symptoms that are not classic. So just because you have them doesn't mean there's not a problem there. Okay, so when you have these problems, so what's so bad about having reflux disease? Well, if the acid splashes up in here, okay, too many times, and in the number we've come up with is that if you have more than 2 attacks of heartburn a week, okay, that's not good. And the reason that is because if you feel this burning sensation in your throat or a bitter taste, which is also another atypical symptom, if you wake up with a bitter taste in the back of your throat, that's acid, okay? That's not allergies, that's acid. And it doesn't have to burn. If you have this bitter taste and it gets better during the day, that's acid too, okay? So if you have those kind of symptoms twice a week or more, that increases the risk of other complications, mainly erosive esophagitis, which happens in 1/3 of all people who have reflux disease. That is when the esophagus actually gets damaged from the acid. You get too many splashes of acid in here, this stuff gets inflamed, it can bleed, okay, and it can also very rarely rupture, but that doesn't happen very often. But most of the time, if you have enough esophagitis, over time, this esophagus will start to swell and get scarred down, and eventually it'll start to shut off, okay? So if you have uncontrolled heartburn, okay, and you don't take something or you don't go to your doctor and have this looked at, eventually this thing can swell enough that you'll start having trouble swallowing, okay? And that's what doctors call a red flag sign. That's not a good thing to have. If you ever start to have heartburn and then you feel like every time I swallow something solid, it just feels like it gets caught. It just stops, and it can just stop just for a few seconds, and then it can pass. But if you continue to ignore it, that period will last longer and longer and longer. And sometimes people say, I have to regurgitate it. It stops. I can't get it down no matter how much fluid I drink, and then I have to regurgitate the food. That's obviously serious and needs to be evaluated. But those are the things that can happen if you ignore this too long. Okay, so obviously, anytime we have more stomach, this fits more into the stomach area. If you take drugs like any kind of anti-inflammatory like Aleve or ibuprofen, those are the most common ones you'd buy over the counter, but Celebrex, all those other kind of things are called anti-inflammatory drugs, non-steroidal anti-inflammatory drugs. Those things, as you know on TV, can cause ulcers and irritate. They can also irritate reflux disease, okay? And the reason they do that is because they diminish the protective coating, okay? These are called prostaglandins, and these chemicals lower that level, and so your stomach becomes like the esophagus. It doesn't have that protective coating, or not nearly as much, and so it can form ulcers inside here, and you can also get gastritis, which is just inflammation without an ulcer. And all simply an ulcer is that you have a lining of your stomach and you've basically formed a little crater in it because the acid has caused damage in here, and that's what truly an ulcer is. If it's not formed a crater because of the acid doing damage, like a pothole, think of it like a pothole, okay? If it's just inflamed, that's called gastritis, okay? But it's all basically extensions of the same thing. So anti-inflammatory medications really hurt more the stomach, okay, because it decreases that protective lining, okay? So, but when you have reflux symptoms or heartburn and it goes more than twice a week, you get these narrowings here, you can have a stomach ulcer. Those ulcers can bleed, okay? They can bleed in the esophagus, they bleed in the stomach, they can bleed. You can even have ulcers just past the stomach in what's called the duodenum. The same process can happen. They can get ulcers there. They can get duodenitis, which is the same thing as with the stomach or the esophagus, just a different place, okay? And those things obviously can bleed. And the first sign of bleeding, when you have symptoms like that, like if you ignore this reflux, you'll have black stools, okay? So why your stool will look like tar, okay? And so that's obviously a bad sign too. So if you have heartburn, all of a sudden your stools are black, you better be going to the doctor. Now, why is that indicative of a bleed? Is because if you bleed in the stomach, you release all these red cells, okay? And these cells, they're red, your blood's red, and these cells, they're like this, and they have all this stuff called hemoglobin in them, okay? And this hemoglobin helps you carry oxygen. That's the chemical that latches on to oxygen and releases it where it needs to go, okay? Well, this hemoglobin has iron inside it, okay? Part of it is what makes up hemoglobin. And when it has oxygen in it, it turns red, okay? Well, when you bleed and you have red cells in here, the acid in the stomach destroys that cell. It makes it rupture, okay? So it destroys that chemical, but it doesn't destroy the iron, okay? So it releases iron, and when iron isn't in that form of hemoglobin, it just comes out natural, and iron is black, okay? So that's why if you notice black stools, that is a bleed somewhere up in your stomach. Okay, so that's obviously another bad sign that you need to be looking for in these situations. Okay, so also, if you have, what causes this kind of reflux besides the things that we talked about? Yes, there's a bacteria that can grow in certain people's stomachs. We don't know how people get it. We don't know if it's really contagious, but this bacteria is called Helicobacter pylori. Okay, this is a bacteria that's actually shaped like a little corkscrew, okay? And it will screw right into the lining of your stomach, and it can live in your stomach, okay, in the acid. And this is also a leading cause of ulcers and heartburn, reflux symptoms, okay? And what it does is your body doesn't like that, so it really increases the acid production in your stomach to try to get rid of it, is what we think happens, okay? And so when that happens, it increases the risk of reflux, ulcers, and problems like that. But what you also need to know is that this drug has been linked to stomach cancer. It does increase the risk of stomach cancer. Not tons, but we think it does have a slight increase. And so if you go see your doctor, and not everybody has this, and not everyone necessarily needs to be tested for this unless you don't get better with the treatments that I'm going to talk to you about later, okay? But this bacteria can cause problems, and there are many different ways of testing for this bacteria, blood tests, biopsies, and whatnot. But these things can be tested and eradicated with antibiotics, okay? So these are the kind of possible problems that you can have with reflux. Some people that fit under reflux, people can have what are called hiatal hernias, and these are actually very common as well. A hiatal hernia is where this part of the stomach is I drew it in here. Let me move this up here. So in a hiatal hernia, your esophagus is here, but what has happened is that your stomach has kind of done this. Like this. Like the diaphragm is still here, where I drew the picture of the lungs. Your lungs are here, okay? Well, hiatal hernia is where the stomach is literally pushed up into your chest, okay? So when that happens, it can just happen. Age, just living, this thing can just bulge up and this hole gets loose and it just pushes up and it herniates in here. So how does that attribute to reflux? Well, when the stomach pushes up through here, it disrupts the shape of that sphincter. So the sphincter gets pushed out and this thing stays wide open, and so the reflux can happen again because the shape of the stomach has altered that, okay? So let's say you go to your doctor and you find out, yeah, I have reflux, so what do you want to do, right? Well, as you know, there are multiple medications out here over the counter, Zantac, Pepcid, Tagamet. Those are what we call H2 blockers. They block a chemical histamine, and there are different types of histamine, one for allergies and one really for stomach, okay? And those are the simplest, easiest ones to start off with to see if it helps your heartburn, okay? If you fail those kinds of drugs, then you have much stronger classes of medication, the Prilosec, Prevacid, there's Dexilant, there's Nexium, there's all these other types of medicines, Acifex, that are called proton pump inhibitors. They block a different system where you pump out acid into your stomach. They're a lot more powerful, okay, than these other ones too, okay. There are advantages and disadvantages of both of these kind of medications. Zantac is very rapid acting, along with Pepcid and Tagamet, but it's not as powerful. Nexium and Prilosec and those kind of drugs are more powerful, but they take longer to work. They don't work as well if you take them as needed. They really take 5 full days of taking it every day to really hit its full effect, okay? So, but they are a lot more effective in what they do. There are some drug interactions that are very important to understand, especially with Prilosec and Nexium. These drugs, if you all have heart disease and you're taking Plavix, you really need to talk to your doctor. If you're taking Nexium or Prilosec specifically, those drugs have been shown to maybe decrease the effectiveness of Plavix. There are other acid blockers that don't seem to do that, that don't interact and make Plavix not work as well, so you need to talk to your doctor about those, okay? So if you have these kind of medications and they help you, great. But if they don't help you and you still have breakthrough symptoms, you need to start looking into other modalities of treatment, okay? Well, there are other drugs that can be taken along with acid blockers, namely the drug of choice after that. If you have an ulcer or if you have gastritis or esophagitis, a lot of doctors will give you another drug called Carafate. It's also called Sucralfate. That's the generic name for that. Those are big gargantuan pills that are basically coaters. What they do is whatever acid your stomach is not blocked by one of these other acid blocking medications, this pill comes down and it's got a liquid in it, and when it hits that acid, it opens up and it forms a protective coating into the stomach. Because your stomach's trying to heal and your esophagus is trying to heal anytime it gets any kind of injury. Well, what these other pills do is they form a protective coating so your body can have something to heal without being bothered by more acid, okay? So there are other ways of going through that. If you fail these kind of medical treatments, then you're looking at surgical options, okay? And one of the most successful surgeries for reflux disease nowadays is called a Nissen, N-I-S-S-E-N, fundoplication, okay? And what that is where they take the stomach, because if this muscle fold is too loose, what they do is they'll take this stomach right here, and imagine your stomach is a bag, and they kind of pull it around the back side of this esophagus, and they basically staple it on there, okay? So they wrap part of the stomach around it, and then it forms that, it makes another sphincter to make it tight. Most of the time you can do these now laparoscopically with a little tiny hole, so it doesn't have to be a major surgery, okay? These are very, very effective surgeries when they're done in the right person, okay? If they're done right, you will never burp and you'll never vomit again, okay? Because it won't open, okay? So, but it will allow the food to pass through. But people who have refractory disease that fail these medicines, and you don't want them to have increased risk of cancer or trouble swallowing and things like that, they have to resort to these. They're very, very successful surgeries, okay? So also, if you have this hiatal hernia down here and it's bad enough that we talked about that hiatal hernia with the stomach's bulging, they can actually also do that surgically and pull the stomach down and basically sew up that hole. They don't have to do any kind of major surgery with that. So those are obviously things to do, but the take-home message is to pay attention to what your classic symptoms are and pay attention to what your atypical, and then that's my most important thing, is you got to pay attention to these subtle ones. Coughing, hoarseness, bitter taste in your mouth, those can also all be signs of reflux, and you definitely don't want to ignore those symptoms because of that, because all the risks over there, okay? And also, since I know I'm talking about reflux, but also every time I talk about anything with your stomach, I always don't ignore your colon, okay? So everybody, even though it's not about reflux, I want you to understand everybody needs to get their colonoscopies and get their screening for that, because it's all tied into one, okay? Colon cancer is the #3 most common cancer in the world. It is the #2 killer in the world, okay, of cancer, but it is the #1 most preventable form of cancer. If you get a colonoscopy, and they can find a polyp, which is just simply a little, if you have a colon, it's just a tube here, and you have, all a polyp is a little growth inside the tube, okay? There are different types of polyps, and some of those polyps are precancerous, and if you ignore them, those are the ones that can turn into cancer. If you get a colonoscopy and they can remove the polyp in there, and those were those precancerous ones, you're going to prevent cancer, okay? Colon cancer caught early is 90% curable, okay? Colon cancer caught late can kill you. All right, so I had to throw that plug in there too, so definitely get your colonoscopies. Don't ignore that. The preps are much better than they used to be. You should not remember a single thing that you get done. Yeah. But that's right. Oh, very good. Yes?
How often should you have a colonoscopy?
A colonoscopy, the standard recommendations are every 10 years starting at the age of 50, unless you have a first-degree relative, brother, sister, mother, father that had colon cancer. Okay? If they have colon cancer, you need to start 10 years before the age that they were diagnosed. So if you had a mother that was 55 and had colon cancer, you need to start at 45, and you screen it every 3 to 5 years. If they find a polyp in you, okay, if it's a precancerous polyp, then depends on the size, it goes from 1 to 5 years. The initial one will be usually a year after that, and if it's clean, they'll go to 3 years, and after that, if it's clean again, they go closer to 5, depending on how well you do. Any other questions?
And colon cancer, how often should you have?
Yeah, at maximum every 3 years. Yes?
Any studies that link acid reflux and colon cancer together?
Not that we know of.
And sleeping propped up, with your upper body propped up, would tend to keep the acid down?
Right, it does. It does seem to do that, yes. But if you're still having symptoms, if you have to prop up in order to feel better, then you really need to consider other options, because that means you're not controlled. Okay.
What's the duodenum?
Duodenum?
What's its purpose?
Oh, that's just that's the first part of the small intestine, right after the stomach. And that, well, where the duodenum is if you, I didn't draw it in here, but your liver and your pancreas, those things, they release chemicals. They release things to help you digest fat, bile, and other things like that to help digest fat and protein, and it comes in at the duodenum right after the stomach. But all it is a tube. It's just the first part.
Inflamed duodenum.
Right.
From
anti-inflammatories. Yeah, that's a classic story.
I thought I had a heart attack.
Yep. Yeah. Will you drink it, or are you going to with the camera? With the camera or with the stuff you drink? With the camera, yeah. It's called an EGD, esophageal gastroduodenoscopy. Right.
When you do the EGD, why did they not see your throat? Because I've been complaining about my throat, and if they said when you did the EGD, they did not see, could not see, don't usually look for it.
That's right, because the tube is so big, you cannot, by the time you can pass through, the tube is not flexible enough, and it's about this big around, they cannot see the vocal cords. It really has to be done from the ear, nose, throat standpoint, because by the time that tube gets to a point where you can see well, it's just from the physical size of the tube, okay? To actually see your vocal cords, you really need to see an ENT, okay? They will scope you from the nose, and it goes down. They can take a much better look at your vocal cords through that. It's a fiber optic scope. It doesn't hurt and runs down. That's a much better way to look at your throat. An EGD is not a way to look at your throat. Yes?
On TV, they say if you're over 75, the risks are more than the benefits of colonoscopy. Do you agree?
Well, it really depends on your quality of life. It's what your life expectancy is. If you think your life expectancy is going to be beyond 10 years, then it's still a good idea. Okay, the data when you look at cancer, there have been studies that show that if you reach 85 years old, okay, and you've never had any form of cancer, major types of cancer outside of skin cancer, that the chances of you developing cancer is very, very, very low. And the reason that is because we think just genetically you're lucky enough that your body's just unlikely to get it. But it really depends. It really should be individualized. To come with a blanket statement like that, some people are very healthy 75-year-old people, and there are 75-year-old people that are not healthy at all. And so it really needs to be depending on how well you do. But colon cancer risk definitely starts at 50. So really, you need to talk to your doctor about how well how your overall health is doing before you decide on that.
What about throat cancer?
Yeah, throat cancer is an entirely different kind of problem. That's really strongly linked to smoking and smokeless tobacco use. That's not really so much with that.
Not from acid reflux?
Mm-mm. No, it's mainly usually from tobacco use.
Oh, I thought it was.
Yeah.
Will you finish?
Yeah, okay.
I take an elderly person to the doctor sometimes.
Uh-huh.
The doctor told her there was no need for her to take calcium pills because she was taking Xanax.
Uh-huh.
And Xanax killed the acid in the stomach. You had to have acid to dissolve the calcium.
Zantac is not powerful enough to decrease the absorption of calcium too much. It's more of a problem with proton pump inhibitors, okay? But that throws me into another thing, since I mentioned about calcium, I have a big mouth, okay? There was a big study that came out, unfortunately, about a week or two ago, that it was a 14-year study that looked specifically at calcium replacement, okay? People that take calcium supplements, surprisingly, were unfortunately 86% more likely to have a heart attack. So that is obviously very troubling news to a lot of doctors that tell people to take calcium for their bone protection, okay? And obviously that needs further study, but their recommendations are to try to avoid your calcium supplement and try to get your calcium through dietary measures. That it didn't seem to happen if you drank milk or had cheese or yogurt, that are also very good sources of calcium. It just seems to be unusually linked to this calcium tablet. I mean, it doesn't necessarily mean you need to talk to your doctor, but you don't. The reason we don't know why that happens, but we know that calcium is linked to blockage, okay? That we see that when people have heart blockages or whatever in their bodies, okay, either the neck or the heart, calcium seems to be attracted to and sticks to these blockages, okay? And so up until this study came out, we thought that the calcium was more of a marker, that it would just seem to stick to blockages. And but now with this kind of new data, they're going to be obviously looking at whether calcium does cause problems. Because I mean, calcium is a mineral, and so if you have calcium, can theoretically, if it's sitting on an artery, does it make it less pliable, less, you know, it becomes more stiff. And so that may be the reason why. Nobody knows that for sure. Okay, this is just a study they followed, and that's obviously going to take some more time to look at.